Pneumoconiosis. Pneumoconiosis is a non-neoplastic reaction of lung in response to inhaled dust. What do I mean? See, let's say there's a person who works in a coal mine. As a result, he's continuously exposed to coal. So he inhales that coal. The coal passes through the respiratory tract and reaches the lung. Inside the lung responds to the inhaled coal in the form of non-neoplastic reaction. As a result, lung damage takes place and the lung ability to function reduces or it is completely over. The lung fails. This is pneumoconiosis. In pneumoconiosis, there is non-neoplastic reaction of the lung in response to what? In response to inhaled dust. Where does this dust come from? This dust comes from a person working in a certain setup, like a miner working in a coal mine. He is continuously exposed to coal. In community medicine, you are going to learn pneumoconiosis as an occupation acquired disease. That is because all the pathologies related to lung is being acquired by the person working in a particular setup. As I said earlier, the miner working in coal mine led to him being continuously exposed to coal, leading to pneumoconiosis. So it is acquired from his job as a coal miner. So it is occupation acquired disease. Fine. And I said that pneumoconiosis is caused due to inhalation of dust, right? What are the types of dust? So there are two types of dust. There's organic dust and mineral dust. Organic dust like hay, cotton, and mineral dust, which are inorganic dust like coal, silica, asbestos. Depending on the type of mineral dust, which causes pneumoconiosis are of various types. That is, if pneumoconiosis is caused by coal, we call it coal worker pneumoconiosis. If pneumoconiosis is caused by silica, we call it silicosis. If pneumoconiosis is caused by asbestos, we call it asbestosis. So these are the three major pneumoconiosis caused by mineral dusts that you need to know in detail. All right. At a corner, you can see this, something I have written in bracket, right? What have I written? I have written 1 to 5 micrometer. What does it mean? What could it possibly mean? It is referring to the size of the dust particle. Dust particle 1 to 5 micrometer in diameter. What's the significance? It is the dust particle of size 1 to 5 micrometer in diameter that is most responsible for causing pneumoconiosis. Why this particular value? Why 1 to 5 micrometer? What if the dust size is less than 1 micrometer? Or what if the dust size is greater than 5 micrometer? What then? See, if the dust size is less than 1 micrometer, it will pass through the respiratory tract and then finally reach the alveoli. But then it can return back outside as well. So if the dust particle size is less than 1 micrometer, it can easily enter in, but then it can easily exit out as well. And if it exits out, it is not gonna show any long reaction, so it is not pathogenic. What if the size is greater than 5 micrometer? Then it will get trapped in the respiratory tract. It will get trapped by the cilia and the mucus of the respiratory tract. It will never enter the lung and long reaction will not take place. All right. Now, the details of the three types of pneumoconiosis. Coal worker pneumoconiosis is caused by exposure to coal. Coal contains carbon. Carbon is an anthracotic pigment. Silicosis is caused by exposure to silica. There are two types of silica, crystalline and amorphous. Crystalline is more pathogenic, namely quartz. What is quartz? Quartz is crystalline SiO2 and it is highly pathogenic. Third is asbestosis, which is caused by exposure to asbestos. All right. Now, how is a person exposed to this? So, exposure to coal is through coal mines. Exposure to silica is through glass industry. because glass is made of silica. Exposure to asbestos is through shipyard industry. What is shipyard industry? Shipyard industry deals with number one, manufacture, and number two, repair of ships. And ship parts are majorly made up of asbestos. So the workers working in shipyard industry are continuously exposed to asbestos. All right. So you need to know about asbestos dust in more detail. Asbestos. So asbestos particles, they are present in two major forms. There are many forms, two major forms. The serpentine chrysolite and amphibole or crocodolite. Serpentine chrysolite, it is most commonly used. That is 90% of the use of asbestos taking place is that of which form? The serpentine chrysolite form. Amphibole, on the other hand, is less prevalent. However, it is way more pathogenic. What do I mean by way more pathogenic? See, asbestos, it causes asbestosis, right? Asbestos causes asbestosis, which is a pneumoconiosis. Now, asbestosis has the tendency to develop into mesothelioma. Mesothelioma. What is mesothelioma? Mesothelioma is the malignant tumor of lung pleura. So out of these two different forms of asbestos, amphibole has a higher tendency to develop, amphibole has the higher tendency to cause mesothelioma. All right. What's the reason behind it? So the reason behind it is the aerodynamics of the particle structure. This is what I mean. So chrysolite is snake-like in structure, snake-like, whirly, coiled. It is whirled, coiled, wavy, so-called serpentine chrysolite. Since it is snake-like, wavy, it is easily trapped in the mucociliary, in the mucus and cilia of the respiratory tract. It is easily trapped, right? So it does not enter the lung and lung reaction does not take place. Amphibole, on the other hand, or crocodolite, on the other hand, it is needle-like and long, So it is easily able to evade or pass through the mucociliary, the mucus and cilia. It is easily able to evade through it and enter the lung, causing asbestosis and then worsening into mesothelioma. All right. Be it silicosis or coal worker pneumoconiosis or asbestosis, the good thing for you is that they all have similar pathogenesis. There is a common pathway in their pathogenesis, and this is how it takes place. First, you have the dust particle itself, which is either coal in coal work causing coal worker pneumoconiosis, silica causing silicosis, or asbestos causing asbestosis. This dust, when the person is exposed to this dust, it gets inhaled in. It passes through the respiratory tract and then enters the alveoli. In your lungs, inside and outside and in between alveoli, there are macrophages. The macrophages found in your lung are called dust cells. So this dust that gets inhaled in are eaten up by the dust cells. So what you get is dust engulfed dust cells or dust laden macrophages. Alright, so there was dust, you inhaled that dust, the dust reached the alveoli of your lung, it got eaten up by the dust cell or the macrophage. Now you have the dust laden macrophage. Now this triggers the macrophage to produce cytokines, in response to which inflammation takes place, which is followed by healing by fibrosis, and then finally there is scarring or scar formation. This is the mool mantra of general pathology. I hope you know this much. There is vascular injury. Vascular injury is followed by inflammation. Inflammation is followed by healing by fibrosis, and then fibrosis leads to scar formation or scarring, right? You know about vascular injury, you know about inflammation, you know about fibrosis, you know about scarring from general path. So the same thing happens for coal worker pneumoconiosis. The coal enters your alveoli, inflammation, fibrosis, scarring. Silicosis, silica enters the alveoli, inflammation, fibrosis, scarring. Asbestos enters the alveoli, inflammation, fibrosis, scarring. However, in asbestosis, this is not there. I'll explain that soon enough. This is not there in asbestosis. Wait, I'll explain. Starting off with coal worker pneumoconiosis. Okay, so coal worker pneumoconiosis is caused by coal, which contains carbon, which is an anthracotic pigment. Depending on the severity of the condition, the severity of the pathology, coal worker pneumoconiosis is of three types. You have anthracosis, simple coal worker pneumoconiosis, and complicated coal worker pneumoconiosis. Let's say there's a person who works in a coal mine. So he's being continuously exposed to carbon or coal. So during initial exposure or the beginning stage, the person gets coal worker pneumoconiosis without any symptom, asymptomatic. This is called anthracosis. Again, so the beginning stage is anthracosis. Now, anthracosis worsens into simple coal worker pneumoconiosis upon 4 to 5 years of exposure, and simple coal worker pneumoconiosis worsens into complicated coal worker pneumoconiosis upon many years of exposure. So initially, the beginning stage is anthracosis, where there is no symptoms, it is asymptomatic. Then there's simple coal worker pneumoconiosis upon 4 to 5 years of exposure, where there is little to no pulmonary dysfunction. And finally, there is complicated coal worker pneumoconiosis upon many years of exposure. Here, the lung function is compromised. Why? Because there is massive fibrosis. Again, go back, common pathogenesis. At the end of the day, what is taking place? Scarring is taking place due to fibrosis. So there is fibrosis and scar formation in the lung, and the lung loses its ability to function. The lung function gets compromised. Since there is massive fibrosis, it is also called complicated coal worker pneumoconiosis, is also called progressive massive fibrosis. Okay, now cross. In anthracosis, the lung contains these black pigmented dots. In simple coal worker pneumoconiosis, the lung contains black nodules and macules. Macules, they are present in the form of a patch, flat patches, and nodules, they are raised lesions. So macules are flat patchy lesions, nodules, they are raised lesions. Complicated coal worker pneumoconiosis, there is complete scarring of the lung. There are black scars. These macules and nodules, they are few millimeter in size. On the other hand, the black scars, they are larger, they are centimeter in size. Microscopy. See, relate with pathogenesis. So first, the coal entered inside, it reached the alveoli. Inside the alveoli, the coal gets eaten up by the macrophage. So you get coal-laden macrophages. Alright. Now the deposition of coal takes place in the interstitial space as well. So coal in interstitial space. In a response to all this, inflammation takes place, which is followed by healing by fibrosis and then scar formation. So there is fibrosis as well. So as the condition worsens, the microscopical stages gets added up as well. As simple as that. So in anthracosis, in all these black dots, these black pigmented dots, you are gonna find coal-laden macrophages. In simple coal worker pneumoconiosis, in all these black macules and nodules, you are going to find coal-laden macrophage plus coal in interstitial space. In complicated coal worker pneumoconiosis, in these black scars, you are going to find coal-laden macrophage plus coal in interstitial space plus fibrosis. This is the microscopy of complicated coal worker pneumoconiosis. All the black things that you are looking at is coal-laden macrophages, and the fibers are a result of fibrosis, healing by fibrosis. Okay. Next up, silicosis. Silicosis is caused by exposure to silica, which is present in crystalline and amorphous form. Which is more pathogenic? Crystalline form is more pathogenic. For example, quartz, which is crystalline SiO2. Alright. Grossly, what is present are the silicotic nodules. So there are silicotic nodules all over the lung. There are silicotic nodules. Sometimes these silicotic nodules might worsen. causing cavitation in the lung. There will also be involvement of lymph nodes. Which lymph nodes? The hilar lymph nodes and the mediastinal lymph nodes. So the lymph nodes, fibrosis occurs, right? And to this fibrosis, there is deposition of calcium, leading to dystrophic calcification. This dystrophic calcification of hilar and mediastinal lymph nodes is appreciable under X-ray in the form of egg cell calcification. So you can look at this bunch of egg cell-like structure, right? This is due to egg cell. This is called egg cell calcification, and this is due to dystrophic calcification of hilar and mediastinal lymph nodes. Okay, microscopy. So this is the pathogenesis showing microscopy. This is what happens. Again, the same thing. Silica enters the alveoli. There is exposure to silica. Silica passes through the respiratory tract, eventually reaches the alveoli. Inside the alveoli, the silica gets eaten up by macrophages, which initiates inflammation, which is followed by fibrosis. So you can see these fibrosis taking place, and then there are these fibroblast cells responsible for the synthesis and secretion of fibers, and eventually there is formation of silicotic nodule. So if I take a microscopic section of this silicotic nodule, take a thin microscopic section of this silicotic nodule, this is what I'm going to see. I'm going to see fibrosis in concentric fashion. Since fibrosis is taking place, there are going to be fibroblast cells as well. And since there is inflammation, there are going to be inflammatory cells as well, which are your lymphocytes. And most importantly, there are going to be deposits of silica. And these silica are eaten up by macrophages. So silica-laden macrophages. Okay, so concentric arrangement of fibers with fibroblast and inflammatory cells, namely lymphocytes, along with deposits of silica and silica engulfed by macrophages. Done. Asbestosis. So asbestosis is caused by asbestos. Asbestos is present predominantly in two forms. They are the serpentine chrysolite and amphibole crocodylite. The serpentine chrysolite, it is used in 90% of the cases. Amphibole crocodylite is less prevalent. However, it is way more pathogenic. That is, asbestos that can cause that has the higher tendency to cause mesothelioma is amphibole crocodylite. The reason being the aerodynamic of their particle structure. The serpentine chrysolite is wavy, so it is easily trapped in the mucocilia of your respiratory tract. On the other hand, the amphibole crocodylite, it is needle-like, thin, elongated, so you can easily pass through the mucocilia of your respiratory tract and then enter your lung and deposit inside the lung, causing asbestosis. Gross. Asbestos, it loves pleura, so it is going to harm your pleura. So there is pleural thickening plus subpleural fibrosis. You might have noticed something. The fibrosis has taken place at the base of the lung, and the fact is that in cold worker pneumoconiosis, in silicosis, most of the times in pneumoconiosis, it's the upper lobe of the lung which is affected. Upper lobe or the upper part of the lower lobe. At the end of the day, it is the upper part of the lung that is affected. However, in asbestosis, it's the base of the lung that is affected. You can see pleural plaque in the gross as well. Okay, microscopy. So the same thing, the asbestos fiber gets inhaled in, it passes through the respiratory tract, then it reaches the alveoli. However, now, like in cold worker pneumoconiosis, the coal got engulfed by alveolar macrophage. In silicosis, the silica got engulfed by alveolar macrophage. But in case of asbestosis, the asbestos fiber is not engulfed by alveolar macrophage. Instead, what happens is that around these asbestos fibers, there is enwrapment of ferritin, which is produced by the macrophage. The ferritin enwraps around and then forms the asbestos body. It forms asbestos body. So if you take a section, microscopic section of asbestotic nodule, you are going to find concentric arrangement of concentric fibrosis, along with fiber secreting fibroblast cells and inflammatory lymphocyte cells, along with not asbestos laden macrophage but asbestos bodies. What are asbestos bodies? Asbestos bodies, number one, they are dumbbell shaped. You can see right here, it is dumbbell shaped. Number two, it is made up of asbestos fiber which is enwrapped by ferritin. Ferritin produced from the macrophage itself. It is enwrapped by ferritin. Since it contains ferritin or iron, it is one of the ferruginous bodies. So it is dumbbell shaped ferruginous body which contains asbestos fibers covered by ferritin produced from macrophage. You can see the asbestos body right here. And with that, we are done with pneumoconiosis. One last revision. All right, so pneumoconiosis. Pneumoconiosis definition: it is non-neoplastic reaction of lung in response to inhaled dust, which can be organic dust like hay and cotton or mineral dust like coal, silica and asbestos. It is an occupation-acquired disease. The size of the dust particle that is highly pathogenic is 1 micrometer to 5 micrometer. Less than 1 micrometer, it is too small, so it can enter in and come out. More than 5 micrometer, it is too large, so it will get trapped in the respiratory tract. 3 types of pneumoconiosis: coal worker pneumoconiosis, silicosis and asbestosis. Coal worker pneumoconiosis caused by coal which contains carbon, which is anthracotic pigment. Silicosis caused by silica, the crystalline form namely quartz, and asbestosis by asbestos, where amphibole is more pathogenic than serpentine chrysolite due to the aerodynamic of the particle structure. Then, as for coal worker pneumoconiosis, there are 3: anthracosis, simple coal worker pneumoconiosis and complicated coal worker pneumoconiosis. Anthracosis is at beginning stage, it is asymptomatic and there is presence of black pigmented dots. Simple coal worker pneumoconiosis is often 4 to 5 years of exposure where there is little to no pulmonary dysfunction and there is presence of black macules or black nodules. In complicated coal worker pneumoconiosis, there is many years of exposure, so there is lung function compromisation. Since there is immense fibrosis, it is also called progressive massive fibrosis, and there are presence of centimeter long black scars. Microscopically, you can see coal laden macrophage, coal in interstitial space and fibrosis. In silicosis, grossly, you can see silicotic nodules, cavitation and egg cell calcification is seen under X-ray. Microscopically, there is concentric arrangement of fibers with fiber-producing fibroblast and inflammatory cells, namely lymphocytes, along with silica-laden macrophages. In asbestosis, grossly, it affects pleura. There is thickening of the pleura and subpleural fibrosis. It affects the base of the lung. Microscopically, there is presence of concentrically arranged fibers with fiber-secreting fibroblast and inflammatory cells, namely lymphocytes. And most importantly, there are asbestos bodies. Asbestos bodies are nothing but dumbbell-shaped ferruginous bodies that is made up of the asbestos fiber, which is coiled or enwrapped by ferritin produced from macrophage. We are done with pneumoconiosis.